Hey, I'm Brittany Arender, and today I'm going to be doing my Injection Checkoff. The first thing I'm going to do is pull up my physician's order, and I'm going to check the physician's order against what's in the patient's MAR. So I'm going to make sure those match and that they and that there isn't any discrepancies. Once I've done that, I'm going to identify my patient and perform hand hygiene. I'm going to don clean gloves. I'm actually going to perform a focused assessment on my patient. So for this medication, the doctor ordered Haldol 4 milligrams for PRN agitation. I'm going to make sure that my patient is exhibiting those signs and symptoms of agitation before I administer the medicine to make sure they really need it. So once I perform my assessment, I am going to pull my medication. So I have my medication here. I am going to check the label against the MAR to make sure I have the correct medicine. And I'm also going to check the expiration date on the bottle. So we're good there. Once I've done that, I'm going to go ahead and prepare my medication. I'm going to cleanse the top of the vial. And for this, I'm going to let that dry. For this order, the physician ordered 4 milligrams, but this is a 5 milligram per ml vial. So I had to do some dosage calculations, and I'm going to be administering 0.8 mLs of this medication that will be equivalent to 4 milligrams. So I'm going to aspirate 0.8 milliliters of air into this vial. I'm going to do that first after I've cleansed the vial. And then now I'm going to draw up 0.8 milliliters worth of medication. Okay, once I've done that, I'm going to expel any air bubbles. Just kind of a fat one in here. All right, and then I'm going to recap. Okay, so now if I'm going to go ahead and change this needle. I'm actually going to put the needle on that I'm going to be administering the medication with. So I'm going to use this is a 25 gauge syringe with a 1-inch needle. If I'm outside of the patient's room, I'm going to go ahead and label my syringe. So once I've done that and I've got the medication all together, I'm going to go into the patient's room and I'm going to perform my third check at the bedside. So again, I'm going to verify my patient. I'm going to check to see that, check my label and make sure it matches the MAR. So once I've done that, I'm going to explain the procedure to my patient. I'm going to say, Mr. Smith, I have an order here for 4 milligrams of Haldol, just because you're experiencing a little bit of agitation. So I'm also going to identify which site I want to use. So with the IM injection, there's 3 different sites you can use: the deltoid, the ventrogluteal area, and the vastus lateralis area. So for my patient, I'm going to pick his deltoid. So we have his deltoid right here. I am going to use the Z-track technique when I'm administering this medication. So I'm going to take my alcohol swab, and I'm going to cleanse the skin for 30 seconds. After 30 seconds of it drying, I am ready to give the medication. So I'm going to pull the patient's skin taut. I'm going to uncap my needle, pull the patient's skin taut with the Z-track technique, and I'm actually going to go in at a 90-degree angle. So, and then I am going to administer 1 ml every 10 seconds. And I'm going to hold the needle in for an additional 10 seconds after I've administered the medication while still pulling the skin taut. After 10 seconds, I can pull this out. I'm going to hold the area, the injection area with the alcohol pad, and I'm not going to recap this needle. I'm going to put it in a sharps container. So once I've done that, if I need to put a Band-Aid or whatever on the patient's skin, I can do that. I am going to remove my gloves, wash hands, or perform hand hygiene, and I'm going to document. So I'll document where I gave the injection, how my patient responded to it, those sorts of things. One thing that the instructions mentioned was that we needed to go over the 6 rights of medication administration. So have the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. So I think that's it. Thank you.